something.
It's
Watch
blue.
your mouth. Florida County Commission now back in session. We're having wings. Matt Cooper.
Good morning, Commissioners. I know we have a lot on the agenda for today regarding the hospital. And my report will be in a little bit different format. You know, over the last several weeks, there's been a lot of inflammatory information that's been disseminated about the hospital. And I suppose that some would like me to address those issues, but other than to say they're just false, I'm not going to get into it. I did want to let you know what I see at Weems. I've been here 1 month, less than a year and a half. I've spent a lot of time trying to get up to speed on a lot of issues that were not right. Our first order of business was to cancel an IT billing and collection contract that was not doing us any favors in collecting our money. The company had missed 2 deadlines regarding implementation of a new system that would have brought us to meaningful use certification. And so we terminated the contract. We implemented an interim plan. We contracted with a new company, and that new company was able to get us to meaningful use certification this past year. And we did all that in 6 months. Now, it would take most hospitals no less than a year to do that, and some spend more than 2 years going through that process. But what does all that mean? Well, the change in companies will result in operating costs being reduced by $50,000 to $75,000 a year. By meeting the meaningful use deadline, we won't be penalized by Medicare $25,000 a year. And also by meeting that deadline, the federal government will reimburse us in excess of $350,000 for the effort. We have also recruited a revenue cycle manager. And contrary to what some people have said, his salary was funded through the reduction in sending monies for consultants to Tennessee. Now, we have that person in our building. He works for us. He's a member of the community. He's doing an awesome job and is an asset. We were able to get a grant for a new ambulance. We've talked about that many times, and all I'll say is that that's the same grant that was turned down the previous 2 times that it was requested. We've recruited a new physician in internal medicine, and I'm going to introduce her in just a minute. Dr. Stoll is capable of taking care of ailments that we have not had that capability in the past. And just recently, actually, the press release went out yesterday, we recruited a new EMS director. And I just wanted to kind of read some things about this gentleman. His name is Jared Wester. He is a local product. He graduated from Port St. Joe. His wife is from Weewall. Just to give you some idea of his passion for this job, he actually completed his EMT training prior to getting his high school diploma. Now, to get your EMT license, you have to have a high school diploma. So on graduation day, he picked up his diploma, drove to Tallahassee to get his license, and came back that night and worked a shift on an ambulance. He's a certified flight paramedic, means that he flies in the helicopter. Not only, most of our paramedics have multiple certifications on what they can do. Jared is not only certified, he's certified to instruct in all of these categories. ACLS, PALS, BLS, PHTLS, AMLS, International Trauma Life Support, PEP, NRP, and then there's a list of other things that he does. In short, he is going to bring so many possibilities regarding our emergency medical services to this community that I'm very high on him, and I think I didn't envision we could get somebody with these credentials when we started that look. I also wanted to mention that in acquiring him, it was done through collaboration with one of our, I will say, competitor. We worked closely with the HCA Hospital in Panama City, and I want to give them a lot of thanks. They helped me source that candidate and actually talked with him while I was interviewing with him to give him some direction. So even though we're competitors, we are also good neighbors, and we work collaboratively where appropriate to provide the best care for all of our patients. And finally, our hospital team was able to resurrect the building program that had laid dormant for a couple years. We've taken it to the point, to the extent that we can, without moving forward with the construction manager as the proposals are laid here. I want to take some time in a minute to show you how far that is, what it looks like, what it accomplishes, etc., and I'll do that in just a minute. But all of these things would be meaningless if we couldn't provide excellent patient care. And you've heard me talk about the hospital-acquired infection rate of being 0 for 3 years in a row. You've heard me talk about our wait time in the ER being half the national average, etc. Yesterday morning, I received a new report from United Healthcare. Now, United Healthcare is a national insurance program, and they do a lot of data collection and quality reporting. And when I say a lot, they may have 100 things that they look at. Now, we can't be measured on everything because we don't have enough discharges to make it statistically meaningful. But we did get measured on 2 this year. We got measured on irregular heart rates, in which we scored a 0% mortality index compared to a national average of 1.2. We also scored a 0% mortality index on congestive heart failure, where the national average is 3.2. And I'm here to say that your hospital is not only competent, it's delivering excellent patient care. And I don't stand here before you today to take credit for these things. To the contrary, I'm delivering this message today for 2 other reasons. First, to demonstrate that your hospital is vibrant, improving, and not only a going concern, but one of the county's greatest assets. And it has a bright future if given the opportunity to bloom. And second, I mention these things to give the credit where it deservedly needs to be, and that's to the doctors, the nurses, the techs, the dietary folks, the clerical, environmental service, EMS, medical assistant, management, and frontline, the thank you they deserve. And I hope you will join me in giving them that. Now, just a couple more things. I wanted to update you on the revenue cycle and where we're at. Since the last time I met with you, we have not needed to take any more money or ask for any more money. I think I reported to you last time that our collections had returned to about $337,000 a month, which is getting close to where we need to be. Through 3 weeks of January, we're projecting January's numbers to be at about 377. So I think things are on the mend. I think we'll actually see those numbers go higher for a few months as we clean up those 3 months that it dipped very low. It's not to say we won't need to ask the clerk for some of the money that you've already approved for this next, to finish out January or the first part of February. I also wanted to mention that our cost report is due to be filed the 29th of January. Again, that is something that wouldn't normally be done until the end of March or April. So we've compressed that down as best we can to get that cost report money back. I'm going out on a limb here, but you know, the federal government has promised us to expedite that process for us. As I've told you, it's well in excess of $1 million. It's in excess of $1.2 million. So we look forward to getting that no later than the 3rd or 4th week of February. Now I'd like to introduce Dr. Stoll, if I can have her come up here. Dr. Stoll began with us last Monday. She spent a half a day in East last week. She'll be going up there just as we've always done on Thursdays and Fridays here forward. The rest of the time she's at West. She's been learning our EMR and things like that. She's got a wealth of knowledge and a wealth of experience, and I just hope that I can keep up with her. Dr. Stoll, would you like to say anything?
Just to thank the commissioners for allowing me to sit in the meeting today. I really appreciate that. If there are ever any medical questions or issues that I can answer for any of you, please feel free to pick up a phone, give me a call. I'm really enjoying the clinics here and hoping to bring them together to be a real integral part of all the communities in Franklin County. We've created a nice work environment where the people that are here have welcomed me completely, and we're enjoying working every day and trying to bring everybody together. So it's a nice mesh of responsibilities and things that we're doing. So thank you so much for allowing me to be here. And as I said, any questions or concerns, please let me know.
Thank you. I'd like to welcome you.
Thank you so much. I appreciate
Thank you
it.
for coming.
Commissioners, if it please you, I would like to give you a brief demonstration of where we are at with the design of a new building, if that works at this time.
Yeah.
Do you need me to hit it right? No.
Sure.
Now, mind you, this is more than conceptual, but it is subject that it might change. And first, I'm just going to let it run, and then I'll play it a second time and stop it at several points to point out what's going on. But this is what it would look like. And as I said, it might change, but it's conceptually, it's pretty much that's what it's going to look like. You see all that white flat area? That's the existing facility. Everything with the spiked roof, that's new. Okay. What I want to point out here is this is what we would call our visitor or outpatient entrance. Okay? And that would go into a waiting area. That is an atrium with open windows to let natural light into that lobby area. This was well, in the hospital world, we call the walking wounded ER entrance. If somebody comes to the ER on their own, if they are brought in by car or bike or taxi or whatever, that's where they would come into. The neat thing that we were able to accomplish here is that you're familiar with our hospital setup. Right now, we have a registration person sits at the ER. We also have a registration person that sits at the front of the hospital. We've combined those, so the same registration person can also do the ER and the outpatient. And at slow times, that's more efficient. I don't need two people to do things like that at slow times. It's also more efficient during times when people are going to lunch and things like that. Well, let me see. Okay, this is the ambulance entrance. It will have a double door vestibule, which basically means it's allowing us to keep the exhaust of the diesel engines out of the ER. That's a common problem in ERs where ambulance backs up and the exhaust gets sucked into it. Also, the trauma area, and this is the ER right here. The trauma area is right inside that door. So once they go in, they're right there where they would be taking care of traumatic patients. I also want to point out something that we were able to do is we were able to create a complete ER envelope. And what that means in design, in hospital design is that once somebody goes into that ER, there's nothing that they will need that will require them to leave that ER. In other words, if you go in there through ambulance or the walking wounded, once you're in that ER, if you need an x-ray, you'll have direct access from the ER to the x-ray. If you need a CAT scan, you'll have direct access to the CAT scan. What that saves is us putting somebody on a stretcher and taking them down the hallway, passing visitors and other patients. It helps with infection control. So we have that complete envelope. Okay, from here back are the patient rooms. There's 10 of them. There's also an activity and dining area, which is required for us to do swing beds. And what is unique about this that I've never seen, and I'm very pleased that we were able to accomplish, is just like we were able to do with the registration up here, we were able to do back here with the nursing station. The nursing station from the ER backs up to the nursing station for the patient rooms. So instead of us, in times where we don't have a lot of patients on the floor, that staff can assist in the ER if necessary, or we can send them home, and vice versa. When the ER is getting slammed on a Saturday night, the staff from the acute care side can also help on the ER side. What else? There's a couple of other things I just want to mention. Let's go all the way around here. Okay, this is the old building right here. But what we've done as a part of this addition is to add this, it's kind of what we call a faux roof line. It basically is matches all of this roof line, but it's designed to, number one, to make the architecture seem seamless, also to hide all the nasty stuff up on top of the roof. So it will all tie together. This whole front, when you look at it from what is that, G Street, it will all look like it's one building. And the other thing I wanted to mention, that we worked extremely hard in moving things around, is that, and it's one more envelope, we were able to get every bit of patient care and need for a visitor will never have to leave the new facility. The only thing that will be in this old facility will be staff. If you're a patient, all of your needs will be taken care of in that new facility. And so, again, that was extremely important to us. This old facility it doesn't meet code. It's not going to be easy to renovate because if you do, you've got to bring it up to code. And so it was very important to us to be able to say that the patients, all of their needs are in this new building. So that's as far as we can go right now. We do have plans. Actually, we're meeting with the architect again on Friday to just solidify just a few things. And then it will be ready. Actually, they'll be not only drawing the boxes, but they'll be putting the doors and the closets and stuff in. That's as far as they can go without the construction manager on board. And with that, I'll answer any questions about the design, or else I'd like to introduce somebody else and very quickly.
Yes. When you're referring to the old building, so that's just going to be administrative staff in there?
It'll be administrative. It will have, actually, we'll be able to get rid of a couple of those trailers out behind the hospital.
Like the one that has these CAT scan in and all that?
It'll move the CAT scan into the new facility. But a patient, I mean, we will have doors up that says staff only. There won't be any patient or visitor needs to go back there.
And one more comment. It really looks like a lot like the clinic in Carabel, the way it's designed and the overhangs, where the vehicles pull in and all. It kind of looks like the clinic over in Carabel, the way it's kind of, I don't know if the same architect did it, but it kind of looks like about like the same type.
One of the first things I told the architect when I got here, my first meeting with him was, I'm not an architect, but I do want to make sure that the feel of this building meshes with what the community is. I don't want to see some monolithic monstrosity that doesn't match the historic district of Appalachia and what it means to be in this area of the country. So I think he's done a fairly good job with that.
I had a question, and how about Clinic West? Is that?
Clinic West, it won't be affected by this. It still sits all the way over here.
Okay.
So it won't be integrated into the new
So
facility?
we may put like a walkway, a covered walkway, because we don't want Dr. Stahl getting wet in the rain. So, but it won't be connected otherwise.
You're going to come to the front and grow out from the front, Mr. Cooper?
Correct.
Okay, is it going to affect where you put the helipad at?
No.
So you're going to be able to
As
do
a matter of fact,
that?
We've already talked to the FAA, and with this design, the helipad should not have to move. We are going to try to do some upgrades on the helipad because it doesn't meet code either, but we don't want to relocate it. That would be an expense that we don't want to get into.
Mr. Chairman, this is a happy day. It's been a long time coming, but I'm very pleased to see some concrete plans.
When we gonna see some brick and mortar?
That's entirely up to the five of you, sir. I would like to have Nick Hill from Adams. Nick is kind of our point person, and he's going to describe the process for the construction manager. Because remember, what we asked for was a request for qualifications. It's not a bid. And there's been a couple snafus in that process, but I would also say that what we're talking about here doesn't cost any money. This is not an additional expense we're asking you to move forward on. This is just the next step in the process to get these guys in, to interview them, to bring them back in a format that we can select a CM and negotiate the price. But I'll let Nick get more detailed with that.
Morning, Commissioners. Again, my name is Nick Hill. I'm with Adams Management Services. We're just we're consultant and basically come in and help hospitals throughout the construction process. And mainly because there's a lot of different times. A lot of times there's a language that's spoken by the contractor and there's a language that's spoken by a hospital. And we want to make sure everybody understands what everybody's talking about. So that's the reason I'm here and to help the hospital through that. Just want to give a quick summary of the construction manager process that we've gone through to this point. Again, the reason for this is to make sure is to go ahead and get the construction manager on board as soon as possible in the design, early in the design process, so we can make sure that the dollars, they can provide a lot more information about how does the design match up with the budget. And we want to make sure that the budget is spent wisely, and that we don't have to go back and make promises on one thing, and then we end up down the road and realize that the budget won't allow all of those. So the sooner we can get them on board, the better. And so what we've done, we went out to we sent out information in newspapers and advertised about the project in several of the local papers. And also had a couple others from out of town as well that we're just had communication with in the past on the project. Went through those, made sure and talked about and went ahead and looked at some of the qualifications, not in a very in-depth process, but went ahead and narrowed that down to what we felt like were 5 good construction managers that had done hospital construction in the state of Florida. They had also had experience with renovation as well. All of those very important to make sure that everything goes smoothly and that we're getting the most qualified company on board as possible. So we sent out to those 5. We sent out an RFQ. At first, we were asking for fee information, our fee proposal as a part of the proposals. And came to find out that public entities in the state of Florida, you cannot, with a CM at risk project, cannot actually ask for the fee or take that into consideration in the initial decision. It just needs to be purely based on qualifications. So we eliminated the cost part of the RFQ, so it is purely just qualifications at this point. Proposals based on team members that they are proposing, their past experience. There's a number of several different things that we will take into consideration, and we'll actually have plan to have interviews with those construction managers as well, and then present their entire plan to us in order before a decision would ever be made. We sent out the RFQs. Proposals were due on the 13th, last Wednesday. 3 of the construction managers turned in their proposals, did arrive on the 13th. 2 of the proposals were sent in by UPS, and UPS had, for some reason, we hit the perfect storm of UPS having planes being held up. I guess all overnight air UPS goes through a central hub. Some planes had technical problems or were delayed, and so 2 proposals did not arrive until Thursday. And so there was immediately the question came up about whether or not those proposals would be accepted. Consulted with several, looking at Florida state law, and to see if that would be acceptable, because we don't want to do anything that's unfair to the others that did to get theirs on time. Ultimately, it comes down to you guys as far as making that decision. And so I wanted to make sure we presented those facts so that y'all have the information and can make that decision. Just to clarify, I did receive, we want to make sure that that those were the true facts. So I did get documentation from both UPS and from the construction managers that proposals were late. that UPS is taking full responsibility for that. Both of those construction managers did send their proposals in by UPS. They sent them out on Tuesday morning and paid for early morning delivery on Wednesday the 13th. Again, they were delayed until the 14th. So that's, again, I don't know if there's anything else you would like to add to that.
Mr. Chairman, if I can, what are the names of the two proposers that were late for the reasons you've just described? We need their names for the record.
Sure, absolutely. It's Doster Construction and Robinson Morton.
Okay. And you have personally, as the county's consultant, reviewed the documentation, physically seen it where they timely put proposals in the mail with the postage prepaid for delivery to the correct address?
Yes, I have.
And also the same thing as to the UPS documentation as to why the deliveries were made late?
Yes, I have.
Okay. Commissioners, with those facts being on the table, it would be my recommendation that you waive the technical defect that those two proposals were submitted late for the reasons stated on the record here this morning.
I'll make a motion that we
Second.
take the attorney advice.
Have a motion second on the floor, all in favor?
Aye.
All opposed, motion carries.